So the traditional hip replacement is done through what's called a posterior approach. It's a large incision that's made through the back. It cuts through the glute muscles to give access to the hip joint. Well, with the direct anterior approach, we don't need to do that anymore. We make a small 3 to 4 inch incision in the front. We access the joint by going in between the muscles and not going through them. Once we replace the hip and take out all the bad parts, what I call the bad parts, the arthritic parts, and put in the implant, everything comes back into place. This allows the patient to immediately get up and put weight on the joint and allows for much faster recovery because those muscles are not being disrupted. So with the direct anterior approach, it allows for a better precision of implant placement, less dissection of soft tissue to allow for earlier recovery, outpatient surgery so patients can go home after surgery, and overall a more precise and natural feeling hip. In addition, in certain people, we use what's called robotic-assisted hip replacement surgery, where a robotic arm comes in to allow a much more precise placement of the implant. Not everybody needs that, but it's something that we use to, again, add another layer of safety and precision to the surgery. If I were to have a hip replacement, it would 100% be the direct anterior approach. I think if you talk to people that have had it done, they'll tell you that it's much less pain after surgery and much quicker return to activity. It's kind of like having a shoe. When your shoe's worn out, but it still performs, keep wearing it. You don't need to get new shoes. When your shoe wears out, but it's changing your gait, it's changing your lifestyle, it's making you do things differently, it's time to get a new one. So when it gets to that point, I think it's a life-changing surgery that not only gives you your ability to do sports and things you've never done before, but it helps all the other body parts that may be ailing and aching as a result of the arthritis. I tailor the approach to the patient. If you're a patient that's going to do better with the direct anterior approach, I do that approach. If you're a patient that would do better with the posterior approach and it's a safer approach, I do the posterior approach. So really, it's not a surgery for waiting till you're 80. It's a surgery for someone who recognizes that they have something wrong with them. They don't want to miss out on their life, and they want to get back the ability to live life and at a younger age.